Yeah. This is for team A. See, you can see the board, no? Yeah. These are all 80% of the questions I've taken from Miller. So it's all from the book, except for a few change here and there. So you can see this somewhere in your textbook. You would have just glanced through or studied. So you just need to identify that. That's all. You get 10 marks. Okay. You have seen this, no? What does that red one represent?
That is the area supplied by the tibial nerve in the ankle. During the ankle blocks, that area is supplied
Specific. Which nerve?
Deep tibial nerve. Deep tibial nerve. Tibial nerve. Tibial nerve.
Tibial nerve will be a very broad answer. You said tibial nerve, no?
Deep.
Deep?
Tibial nerve.
You have a name for that?
Peroneal.
51 seconds.
You're right, but need to. If you say sciatic or.
1 minute.
Yeah. Team B.
Peroneal nerve.
Deep peroneal nerve. It's called deep peroneal nerve. How can you say that it's a deep tibial nerve? You need to be a bit more specific. I know the concept, but it have few names on that. Okay. So team B have 5. Okay. Now question to team B. Right? You're ready. You have seen this very frequently, no? You know normal. What does the small one on the left side represent? What is the disease?
Mitral stenosis.
Yeah, it's mitral stenosis. You can see the reduced ejection fraction and the small left ventricular load is less. It's mitral stenosis. Full marks for you. Team B has 10. Ready, team C? You have seen this again. It's a cardiac cycle. I've made 2 points, 1 and 2. You just need to answer what is the critical event that is happening at 1. Point 1. If you look into the diagram itself, you can understand. It's very, very simple. Don't worry about 2, just go to 1.
Mitral valve closes.
Oh, that's it. Very simple, no? Very good. It's closure of the mitral valve. Then after that, you can see the rise in the during the contraction. That's right. 10 points to C. D, you're ready. Very simple. Again, it's a pressure volume loop. The normal is the light green. I've marked 1, 2, and 3 abnormals. You just need to count and answer what is happening in 3. What is 3 represent? What kind of disease is this? Pressure, volume.
Fixed intrathoracic.
Relate to the pressure change, volume change, see the normal and see the abnormal. I've asked for the 3 only. 1, 2 and 3 are abnormal.
Time is up.
Restrictive lung.
Very good. That's restrictive lung disease. Okay, you can say it's fibrosis. That's how it was given in Miller. Anyway, restrictive lung disease is the same. The pressure is increasing too much. The volume is not building up accordingly. Okay, so that's true. That's the end of first go. Now, can we go to the next one? So, can we start from here and go to the other side, or you want to start? Okay. From you, D. Very simple question. You have seen this, no? In your book. You just need to identify what is written at star. Or, if you want me to explain, it is they are assessing the sensitivity of identifying a venous air embolism by various spectrum of investigations. So what is the most sensitive investigation which is located at the star which help you to identify that?
Transthoracic echo.
That's right. Transthoracic echo. That's fine. Full marks for you. Question to team C. Okay? Ready? It's a very simple question again. What is this?
rapid sequence induction and inhibition. Selix manual.
This is. Can I go to the next? What I'm asking is, can I pass the question?
No.
Do you think that I'll ask you Selix maneuver? See how many hands are there. So many people are struggling. It's a maneuver actually. How can I help you more than this?
Time is up.
Okay.
Pass the question. No? Actually, you can't see the person who is doing the key job. Only his hands are there. Team B. Mike.
Manual inline stabilization.
Mills maneuver. It's manual inline stabilization. For a cervical trauma, you can see the collar as well. Okay. 5 marks for team B. Now the question is again to team B, right? You are ready. You have seen this graph. It's cerebral perfusion pressure and cerebral blood flow. The bold one, normal, is a normal one. You can see a dotted one. What does it represent?
Hypertensive patient.
Very good. It's chronic hypertension where you can see the shift to the right side. A higher set of the CPPN, pressure maintenance. Full marks for them. Are you ready? Team A? Don't worry about that. Just tell me the name of this. This is a very important thing. It's one of the most beautifully described diagram in the initial part of your Miller. You have to tell the name of this.
Reperfusion syndrome. DIC.
All these are part of it, but tell me the name.
Okay, cellular edema.
Time is up.
SIRS.
Yeah. It comes to team D.
Acute inflammatory response.
Sorry?
Ischemic insult.
You mean SIRS?
Acute inflammatory response. Stress response.
No. I'm asking you the specific term. It's described in that term in the textbook. 3 pages written on that. Very, very relevant for us as anesthesiologist, especially when you are working in an emergency suite.
Trauma.
Yeah, team C.
Systemic inflammatory response syndrome.
That's what they said.
Multi-organ dysfunction syndrome.
Okay. Team B.
Hemorrhage.
Yeah, it happens after hemorrhage. That's right. What is it called? Now I'll give you a clue. No marks. It's called
Hypovolemic shock.
no, it's called shock. It's called shock cascade. Shock cascade. It's called so. Okay. This is the events that is going to happen when there is a severe shock. See, injury and hemorrhage happens at one end, but the systemic effects happen to the whole body. This is explained by this beautiful diagram. It's very well called shock cascade in the textbook. So, from where do we start now? Yeah, we'll start from A. Ready? This is just a echo. You just need to give the diagnosis. Since it's not a very familiar picture for you, I'll give you a small clue. It's an emergency.
The view and
I'll tell you the diagnosis in another 10 seconds. LV is maintained, RV is collapsed.
Right atrial thrombus. Time up.
Time up, team B.
Embolism. Embolism.
Embolism, team C. That's thrombus, no? RV is collapsed. It's an emergency.
Ventricular rupture.
LV is normal. That also I mentioned. LV is normal, RV is collapsed. It's an emergency. D.
Cardiac tamponade.
That's right. It's a cardiac tamponade. See, it's very well given. See, you can see there is a. Oh, sorry. It's actually, you can see the arrow is marked there. There is a collapse since the RV is very small. I mean, thin walled, it's pushing, while the LV is maintaining. I told you it's an emergency. Even if you don't know the echo, there are only very few emergencies. Can we go to the next one? Team B. You know what is this? Circle of Willis. They are notorious to have abnormal anatomy. Circle of Willis. They will not be as beautiful as we see, So what is the most common anomaly which you see of the 6 type? First one is normal. 2, 3, 4, 5 and 6 is abnormal. Which is the most common anomaly of the circle of Willis?
Two.
Anterior communicating. Number 2. Okay. Can I pass the question? Team C.
Four. Positive.
Okay. I'll tell you the answer at the last. Can I pass the question?
5.
Very good. That's right. Posterior communicating. That's right. 27% of circle of Willis abnormality is posterior communicating deficiency. Okay. Points to D. 5 points. Now, your question, Team C. Again, very, very easy question. You just need to identify what is number which I marked, the question mark. It's a very, very important.
Synaptobrevin. Synaptobrevin.
It's a single, synaptobrevin is a single protein, isn't it? It's a array of proteins, a multiple proteins, which is essentially responsible for the vesicle which contains acetylcholine to bind and degranulate into the synaptic cleft. The group is called dash protein.
Snare protein.
That's right. It's snare protein. Snare protein. Okay. So marks for you. You missed it actually. No, don't worry. Here comes your question. Very, very simple question. Das have given a beautiful guidelines to how to manage a difficult airway. So when it comes to the third one, something is missing. Just fill the gap.
Mask ventilation.
Very good. It's mass ventilation. You have one more sector. If you fail to oxygenate by mass ventilation, you will have to go to the next one. What is that? How can you miss that? Being an anesthesiologist, you are not supposed to miss that. We are notorious for that.
We have to try one.
Timer.
Try one.
Time up. Yeah.
Try one. Postpone the surgery.
Yeah, postpone the surgery. So 5 marks for them, 5 marks for them. Okay. So that completes the first round. Can we have the score now?
Total score.
Yeah.
Group A, 5 points. Group
5. Just now you got 5, no? That's only 5. Okay.
Group B, 30 points.
30.
Group C, 20 points.
20.
Group D, 35 points.
35. Okay, good. Now, next round is very, very easy round. Okay. How is this? You are okay with this, no? Okay. Next is a very easy round. You'll not miss this. It's about golden history, which, what happened? History is very simple. Who wants to take A, B, C, D? You want to take? No, you are, or we'll give them for a change. C, B and C. Who want to take? B. Okay. Benji, your question. The questions are like this. Total you get 10 points. Okay. 5 marks for identification, 5 marks for the sub-question. First question. Identify this person.
August Bayer.
Very good. August Baer. You got 5 points. The next question is, whom did he give the spinal?
To his colleague. And himself. August something.
This is August Baer. You said August Baer, no?
Yes.
You got 5 marks, no? Second question. Whom did he give spinal? First time.
Himself,
Come on, yaar. How can you give like that?
colleague,
Colleague. Colleague in the pera choikinde.
His name also starts with August something. Alexa.
Just guess. He was actually
Time
not.
up.
Yeah, time up. Sorry.
Leonard Corning.
Huh?
Corning. Leonard Corning.
Leonard Corning. No. Oh, no. Yeah. You want to pass the question? Yeah. There is no negative.
John Rigger.
Huh?
John Rigger.
No, it's Hellbrand. Hellbrand. He was not his colleague actually. He was his disciple, student. So that was a, so the teacher actually gave to the student, first student was made as a subject after that. Okay. So 5 plus 5. Alla, 5 plus 5, only 5.
Only
This is for me. Okay. See. Again the same rule. Identify 5 marks. Sub question 5 marks. Are you ready? No, wait. The question is coming. Okay. The question is, what did the surgeon said to the audience after this event? That's 5 marks question. Once you answer that, I'll give you the next 5.
Free from pain. Surgery shall be pain free. Something.
My question is, what did that surgeon told? It's beautifully written in inverted comma in the book. After giving anesthesia for the first time, when W.T.G. Morton was complimented in front of the public by the surgeon Dr. Warren, by this term, he told to the public who was looking all around, peeping from the gallery, that inverted comma.
Time over.
There is no humbug.
Very good. Gentlemen, this is no humbug. That's the question. This is not a black magic. 5 marks for you. Okay. Now you have another option for another 5 marks. Okay. Who coined the term anesthesia? A person sitting here was actually the person, he was a writer among physicians. He actually coined the term anesthesia. Who is the person? Audience question ഇല്ല. Yeah. Can I pass the question?
Jon Snow.
എന്ത് പറ്റി? ഇല്ല, ഇവിടേക്ക് പാസ് ചെയ്യണ്ടേ? എന്നിട്ടല്ലേ വരാൻ പറ്റുള്ളൂ. This question was for them, then it passed to them. Oh, you gave the answer last time. So I will pass the question here. That's fair, no?
Time out.
Time up. So
Oliver Wendell Holmes.
Oliver Wendell Holmes. Oliver Wendell Holmes is the right answer. That's right. Team A. Don't worry. Now, this is for you, no? Question. Identify this person.
Jon Snow.
Very good. It's Jon Snow. Now, sub question. Any other contribution?
Epidemiology.
Yeah, he's called the father of epidemiology also. He's a person who is defined that. 10 marks for them. Okay. Yeah. I told you, no, it's a very easy area for you. Identify this person. That's right.
Sir, Ivan Magils.
He is Ivan Magil. Now comes 5 marks for them. Another sub question. He has lot of contributions, right? Of which what is called Magill's curve? Magill's curve. Magill's curve. C-U-R-V-E. Curve. It's a very, you are utilizing that every day in your practice. Yeah, that's right.
That is the curve of that scope.
Huh?
Endotracheal tubes. That,
Very good, very good. That's a curve of the endotracheal tube is called, since Arjun has told that, just tell me the number also. Anyway, foot marks for you, 10 marks for them. What is a curve? Yeah, audience question. Very good. 140 plus or minus 20. That's right. Good. So 10 marks for you. Now you are left over, no? Alla, complete ಆಯಿಲ್ಲಿ.
Completed.
Okay. So can we have the score now? History question easy അല്ലേ?
So team A have a score of 20 points, team
20.
B 35 points, team C 20 points, and team D with 50 points.
50 points. Very good. Now, next is rather easier question. Very, very simple question. 10 marks for the identification, passing 5 marks. Okay? It's about pharmacology. Who wants this? See, you want to take up. Just need to give the answer, that's all. Okay? Who am I? That's the answer which you have to give. I'll give you the description. You want to answer this? Okay, I'll give you the full. Read this full and give me the answer. Only one option. You cannot check it multiple times. If you miss that, I'll change the question.
Magnesium sulfate.
That's right. Magnesium is the answer. Magnesium has got so much advantages. I've given multiple clues. This is essentially to give you the information regarding the drug. That's all. Okay. Since it's very important for you as a postgraduate, I thought I'll share it with you. That's just a way of asking. Okay. It's magnesium. Team D.
So 10 points, right?
Yeah, 10 points for them. Full is 10, pass is 5. Yeah. Identify me.
Liposomal bupivacaine.
Very good. That's liposomal bupivacaine. Very good. That's right. I've given clue also. Anyway, but I told you, the intention is very simple. Every question will have that. Don't worry. So 10 marks for you. It's a coming up pharmacological agent which you will be seeing very soon. Can we have it? Team A. Very, very simple.
Sugamadex.
Yeah, it's a Sugmadex. You have description as well as diagram. Either one is sufficient to give you an answer, but so it's 10 marks for them. For you.
Medasol.
Yeah, benzodiazepine midazolam is the answer, which opens the ring dynamically on a pH of 4. That's right. So all had 10. Right. Okay, good. So this is essentially to make everybody have some points. Okay. We'll go to the next one. It's a question on regional anesthesia. Okay. It's a single description. Who wants to take? You will be taking. Okay. You just need to give what it is. The most characteristic point of this. That's all. If you answer that, 10 marks for you. If you pass, you will get 5 marks. What is high pack block? It's again coming up in a big way. Either you give the full name or tell me the most characteristic feature of this block.
It provide only analgesia. No anesthesia.
Can you be more specific? And effectively, any blocks are to provide analgesia. You have another 20 minutes to think. 20 seconds. How much time?
Time up.
Time up. Yeah.
Is it that infiltration between popliteal artery and the capsule of knee joint?
Tell me the full name. What is high pack?
The infiltration between popliteal artery
Okay,
and the
make it louder.
infiltration between popliteal artery and capsule of the knee joint.
Tell me the full form
High,
of high pack.
that's what.
For infiltration around the popliteal.
Tell me the full form. The question is very simple. Then only I can give the answer. I mean, I can give you the marks, no? Shall we pass? Yeah. Team A. Right.
High infiltration.
Huh?
High infiltration around popliteal artery and knee.
That's what she was trying to say, no? What is the full form of high pack?
HIPAC unit.
HIPAC. Team B. Team B. Now, no marks. I'll give you a clue. It is high volume, proximal, adductor canal block. That's it. It provides only analgesia, no muscle relaxation, so that the patient can walk after this. Okay, it's coming up in a big way, especially for knee surgeries. Okay, high volume, proximal adductor canal block. Okay, who had taken up this question? You have taken. Okay, now it's your turn. What is the most highlighted advantage of dual subsartorial block?
No motor blockade.
Exactly. No motor blockade. That's right. 10 marks for them. Because this is actually increasing in arthroscopy, knee arthroscopies, and it's a trend now, isn't it? Your hospital do that? Yeah, that's right. Very good. So 10 marks for them. Now to team A. You are ready, right? Just need to say, what is this? What is this sign called? Yeah, that's right. Just tell the name. അർജുൻ പറഞ്ഞതും കാണിച്ചതൊക്കെ ശരിയാ. നീ ആ പേര് മാത്രം പറഞ്ഞാൽ മതി.
Antler sign or a bicycle handle sign?
എന്ത് സൈൻ?
Bicycle handle. Antler sign.
Yeah, I will pass the question. Only one option, okay. Team B, Benji.
Callot sign.
Team C. Team D.
Mercedes Benz.
എവിടെ പെൻസ് അവിടെ? Okay. Team D.
Pass.
നിങ്ങളാരും you people never go to seashore? Yeah, so what is this sign?
Barcode sign.
Oh, the barcode. What is this, audience? It's seagull sign. Arjun, പറക്കണതാണത്. Benz is having a different emblem altogether. Okay. Are we ready? Seagull sign. You can see the celiac trunk coming from the aorta. It divides into splenic and hepatic, which gives us classic. When you do ultrasound, hepatic block, for that you look into the seagull sign. Yeah, come back to who wants to take up the next question? Team B. Ready? It's a very simple question. Where is modified swoosh test used?
Caudal epidural blocks.
Yeah, was it too simple? Oh, right. Now tell me, then tell me, what is the difference of how is it modified? Anyway, you got the marks. What was the modification? What was the original test?
In original test, we used to inject air and
What is the name?
push test.
It is whoosh test.
This one we are injecting.
This is modified swoosh test.
We are
That was air. This is saline. That's the difference. Okay, good. Caudal epidural. Yeah. Are we through of it? Oru round ayo. Can we have the marks again? We'll go to the round 5 now.
After round 4, Team A have 30 marks, Team B has 55 marks, Team C has 30 marks, and Team D has 70 points.
70 points. Okay. So team D is leading. Good. Are we ready now? This is for machines. Machines and monitors. Basically machines. So who wants to take this first? See, it's your option. You can take. Who want to take? You want to take. Somebody take up. No. Then only I can give mark. You remember, first question will be always simple. You want to take up. Yeah. 10 marks. Identify this. Baska mass. So unnecessary you wasted now. So 10 marks. Can we go to the next one? Yeah, team A. Unfortunately, whenever they take up the first question, it comes to you. You want to go in the reverse order. You want to take up this? Okay. Identify this.
Thromboelastography.
Very good. It's a tech machine. 10 marks for them. We want the next one? Give the full name, okay? Identify this. It's written Safira. The clue is also already there. And what is it used for? It's again a newer trend, newer machine coming up. When you become more and more patient safety oriented, you get this. You definitely have to buy this. Every clue is there. Ready? What are you monitoring with this? That's the last clue I can give.
Timer.
Yeah, sorry. Yeah. Team A. Team D. Team. This is Safira's injection used for monitoring the pressure during injection. So this will try to protect your intraneural nerve injections. So the moment you get a neural injection, you feel pain. So in order to avoid those, they have come up with Safira's system. Okay, this is a new one. Okay. Who want to take up the next one, the easiest? You are the only option. See, it's the easiest. Tell me what it is, the full name. Eh? What is this? The most advanced or the most demanding specialty after anesthesia is critical care, isn't it? Newer modes of ventilation.
Time is up.
Sorry, I'll just give 1 second for him. Yeah. You said something.
Thrive.
Thrive. Okay. Whom should I pass? To team D. Yeah. Hey? This is there in your Miller also. ശംശനാണ് പറയണ എല്ലാ ബുക്കിലും ഉണ്ടെന്നാ പറയണത്. It's there in every book, it seems. Yeah, team B.
NAVA,
Very good. NAVA. What is the full form?
neurally adjusted ventilatory assist.
Ventilatory assist. That's a newer modes of ventilation, no? It's a short note for you. Okay. So 5 marks for team C. So that completes our major rounds. Now we are ready for the rapid. That's the last round. Okay. So what's the score now?
Team A with 30 points, Team B with 55 points, Team C with 45 points, and Team D with 80 points.
Okay. Do you want negative marks for I'll give you the general idea. See, this is 10 marks question total. 10 marks. 10 questions. If you answer full, you will lose, or we'll put it 2. So easy to calculate for you. So 2 for correct. If you make a mistake, it's -1. Okay, 2 marks for correct. Wrong answer, -1. Okay. Total 20 points. Total 20 points, 10 question. If you I'll get you the first question. If you answer that, you will have 2 marks. If you miss that, you can pass that question. If you attempt and fail, that will take away 1 point from you. And the total time is 1 minute. Each question 2 marks. Is it complicated? See, you have only 1 minute. In 1 minute, you can answer maximum of 10 questions. Okay. And the maximum mark you can get from 1 question is 2. That means 20 marks. Huh? Total 20 ullu. Ainda parathilla. Okay. So 20. But see, after I give you the question, you cannot go back to the previous question and answer. Okay. So either you pass, or you attempt, or you give a correct answer. If you correctly give answer, you get 2 points. If you make it a mistake, you get -1. And if you don't do anything, just you can pass on to the next question. You have total 1 minute. At the end of 1 minute, we will stop. If you have attempted only 6, you will get only 6, the marks of the 6 questions. Are you ready? You are ready. You keep the timing. One person can have the score. Yeah. The first question. Who want to take the first round? Again, nobody wants. I've given you a number of clues also. The first will be the easiest. Anyway, who want the first? No takers. You want the first. Okay, ready. Team A. First question. Time starts now. What is 1 met? Pass. Damage control resuscitation targets systolic blood pressure at 90. Very good. 2 marks for them. What is Gutsche sign?
Pass.
Next question. What is stair climbing test?
Pass.
What is EtCO2 confirmation for tube? In situ should have at least dash number of breaths on the capnograph.
8.
8. That's wrong. 7. You were there. -1. Whole brain oxygen consumption represent approximately dash % of total body oxygen. Pass. Warfarin induced is immediately reversed by
1 minute over.
it plasma concentrate. Prothrombin plasma concentrate. Okay, we'll go to the next one. Team B. Ready? General hemoglobin threshold of RBC transfusion without massive hemorrhage. General without massive hemorrhage.
7.
7 is right answer. 2 marks. Bessett's formula is used in. Bessett's formula.
Pass.
Pass. In shuttle walk test, the distance between 2 points is
25 meter.
it's 10 meter. Sorry, -1 for them. KPD is the most popular combination used for.
Pass.
A state of increased vulnerability to physiologic stress is known as.
Frailty.
Frailty is the right answer. Brain's normal CMRO2 is dash ml per 100 gram.
Time up.
Yeah, it's 3.5 ml. Ready? We'll start once you're ready. You're ready. James Lidd is known for.
Pass.
Pass. He's a person who. Okay. General hemoglobin threshold for RBC transfusion for those who with acute.
10.
8. Asholus test is for assessing.
Succinylcholine apnea.
Yeah, that's right. Pseudocholinesterase. That's right. 2 marks. Eriscat index is used for.
Pass.
What is MEC-sleepy?
Like the artificial intelligence.
Yeah, it's automated. It's called CLAD. Anyway, 2 marks for you. In normal human subjects, CBF is auto-regulated between cerebral blood flow.
50 to 150.
Okay,
mm.
70 to 150. 50 is okay. 2 marks. Unit of cryoprecipitate contained a volume of
15 ml.
10 to 15 ml. That's right. pH of hydroxyethyl starch.
Time up.
5.
5. That's right answer. Okay. 4 to 5.5 is the right answer. The last one. You ready? Ready? Numerator Farsi.
2.5 liters.
That's right. Next. Blood look MOPS 30 into 30. Contains how much ml?
100 ml.
That's right. Bailey's maneuver.
Exchanging endotracheal tube with
Exchanging. That's right. 2 marks. Use of dural sac cross-sectional index area is used in calculating dash.
Pass.
Most common drug combination used for TCA.
Propofol and Dexmed.
Huh? Propofol and?
Dexmed.
Wrong. It's propofol and fentanyl.
Fentanyl.
That's right. We'll keep 0. Anyway, CMR decreased by dash percentage.
6.
6%. That's right. Charlson index is used for.
Pass.
Hilton's law.
Like nerve supply.
The nerve that passes the joint has
That's
to supply
right.
the joint.
With joints, the
1 minute,
supplies
sir.
the area. That's right. Right. Okay. Fine. Thank you for your patient hearing and cooperation. It's a wonderful team, actually. Good.